right, we are live. All right, welcome everybody. Welcome to our Rush Generations lecture on stroke education and awareness. We're really happy to have you here. Thank you for finding your way to the lecture, whether you've joined online on YouTube or if you're joining in over the phone. I'm Jasmine Chandy. I'm the program coordinator for Rush Generations. And so for those who may be new to Rush Generations, welcome. We're happy to have you. Rush Generations is a health and wellness program that's all about aging as best as we can. So we have a number of great programs like these lectures that take place about twice a month, fitness classes, support groups, and tons of other programs that we're going to share at the end of the lecture too. And so throughout this lecture, if you have any questions for our speakers or any comments, you can add them to the live chat on YouTube. So if you're on a computer, you'll see that on the right side of your screen. If you're on a tablet or maybe a smartphone, it'll be on the bottom of the screen. But either way, you'll see a button that says live chat. And over there, you can add in any questions or comments throughout the lecture. And then at the end of the lecture, we'll go ahead and share those with our speakers. And welcome, I see people joining in over the phone. And so without further ado, I'm going to go ahead and introduce our speakers. We're going to start off with Dr. Cherian. So Dr. Cherian is an associate professor of vascular neurology and has a master's degree in clinical research. Her research is supported by NIH funding, exploring the role of nutrition on post-stroke outcomes, including cognition and mental health, with work that has been published in a variety of scientific journals and featured in media coverage, including NPR, The Wall Street Journal, ABC News, Good Morning America, and The Atlantic. She is the Assistant Dean of Advising for Rush Medical College, is on the executive board for the Illinois State Neurologic Society, and has also served as the Vascular Neurology Fellowship Director. And for those of you on the phone, if you can just press mute, that would be so helpful. Next, I'm going to introduce Deborah Lynch. Deborah Lynch is an advanced practice nurse and is a stroke coordinator at Rush. She's been in this role for the past 6 years, and before that, she worked as a stroke coordinator at North Shore for 12 years. She likes to bike and jog and has done multiple marathons and triathlons since this started incorporating regular exercise into her weekly routine back in her 20s. She is here today to share with you her understanding of stroke and her appreciation of the benefits of physical activity. So we'll go ahead and welcome our speakers and start off with Dr. Cherian.
All right, thank you so much. I'm going to go ahead and can we share the screen here for my slides? Or do you want me to reshare it here?
Yes, you can go ahead and share it. We can't see it yet.
Let's try this. Can everyone see that?
Yes, perfect.
Okay, perfect. Okay, well, thank you so much for inviting me to come talk today. This is an easy lecture for me to do because it's one of my favorite topics. We're going to talk a little bit about the role of nutrition and what we eat and how that affects our risk of stroke. So my lecture is entitled Food for Thought, Are We Paying Enough Attention to Nutrition in Stroke Prevention? And let's see, it's not letting me, there we go. So we'll talk a little bit about what most Americans eat and also a little bit about why we eat what we eat. And we'll talk about primary stroke prevention, which means the first stroke, preventing you from ever having a stroke in the first place. And we say an inch of prevention is worth a pound of cure. Really, your best bet is to avoid being in the boat of ever having a stroke. For those who have had strokes, though, one of the most important things long-term about your functional status, your outcome, is preventing the double whammy or preventing another stroke from happening. So it's extra important for those who have had strokes who know they are in that high-risk category to really do everything they can to try to lower their risk of having another stroke. And we'll talk a little bit about neuroimaging and pathology by dietary pattern. And this is when we actually go and look at the brain, the structure of the brain, and even down to a cellular level with a microscope, and seeing some interesting changes that depend on our diet. And so it's the old adage, you are what you eat. And I think that actually may be true. And then finally, we'll talk a little bit about the role of diet on stroke outcomes. And we obviously talk a lot about strength and movement, but there's also some really interesting data on mental health outcomes, particularly depression and anxiety, and also cognitive function. So after having a stroke, the risk of dementia doubles. And so everybody has the risk of losing some of their cognitive dysfunction with normal aging, but that's an accelerated risk for somebody who's had a stroke. So we'll talk a bit about how nutrition can hopefully make us more resilient and prevent some of that cognitive decline. So I'm not the first person to have this idea that food helps us protect our brains and our bodies. This is Hippocrates, who's known to be the father of modern medicine. 431 BC was attributed as saying, let food be thy medicine. And when we think about, and I talk to my patients a lot about this, we give them a lot of medicines, a lot of pills, and those are really amazing and beneficial, but most of what we put in our body is food. And so why not be smart about it, and why not make the food that we choose actually work as hard as it can for us and actually benefit us and try to keep it. So just some background reminders about stroke. May is Stroke Awareness Month, so thank you for taking the time to learn a little bit more about it. It is the leading cause of disability, and the risk of stroke doubles for each successive decade after age 55. So there's a lot what we call modifiable and non-modifiable risk factors for stroke. So things that are modifiable that we can change and work on are things like diabetes and hypertension and what we eat and our exercise. The biggest thing though is age, and we can't, at least not now, do much about that. And so as we get older, it becomes extra important that we really work hard on those things we can work on, the modifiable risk factors, because the biggest risk is just as we get older, the risk of stroke increases. So the prevalence growth to 3.4 million people by 2030, and the projected cost of stroke is $184.3 billion in direct costs alone. And just to tell you the difference between direct and indirect, direct cost means the hospital stay and some of the medicines that you have to get. Indirect costs, which are even more than this, are what if you were 55 and working full time and you had a stroke, and you were paying taxes and doing all sorts of things, and now you're out of the workforce and maybe in a nursing home, right? So there's a lot of cost to society for treating strokes, in addition to the cost to the individual. And then I put in this other line here that less than 10% of people get IV TPA or clot busting drugs or surgery where we can go in and pull the clot out. So there's amazing treatments we have for stroke, but a lot of people don't make it to the hospital in time, or aren't aware of their symptoms, or aren't aware that there are things we can do. And so that's why it's important just to remember, anytime I talk to a group about stroke treatment and prevention, just to be aware that time is brain, and you've got to get into the hospital quickly to try to minimize the damage, or maybe even reverse it. Okay, so why focus on nutrition? Lifestyle interventions like diet and exercise can really be helpful at the population level. If you think about all Americans and all the things we do, how we eat, we could really improve the health nationally substantially if we had some improvement to our diet. There's a lot of evidence out there linking nutrition to stroke prevention, and we'll talk a little bit more about that in detail in a few minutes here. And the other thing is that a lot of the big risk factors for stroke have a dietary basis. So if you think of diabetes, a lot of what we eat in terms of complex carbohydrates and sugars can affect the control of diabetes. High blood pressure has a very well documented link to sodium or salt intake. And high cholesterol, we get it from two places. One is genetic, hereditary, it's what your liver, what your body makes on its own. And the other is the food that you take in, specifically saturated fats, so things like red meat and butter and all of that. And then all these things kind of lead to heart disease, which heart disease can actually cause strokes too. If you have a heart attack, it can throw a clot up to your brain and you can have a stroke. So all these things have a dietary basis, and they're really sort of the building blocks. A lot of times after years and years of eating a certain way, that people start to develop some of these risk factors like diabetes, hypertension, hyperlipidemia that may put them at. So here is a graph here showing the stroke mortality in the US. And what you'll notice about this here, so dark purple are the areas in the country that have higher rates of death by stroke. And you'll notice that in the southeastern portion of the United States, there's an area called the stroke belt, which is where stroke is more common than it is in other areas of the US. And one of the interesting links that they've made is that the traditional diet in this cultural region is a lot more fried foods, sweetened beverages. So you think of, sweet tea and fried chicken and all of that. And there's that link again of the vascular risk factors and the risk of stroke. So this is kind of a busy slide here, but it comes from the American Heart Association. And it basically shows you, based on how many calories you're eating, how many servings of different fruits and vegetables that you should be eating. So this is kind of a rule of thumb. Obviously, if you're a bigger person and you need more calories, let's say you're eating 2,500 calories a day, you're going to need to eat more vegetables and fruits. But it shows you that distribution and that breakdown. And this graph is really, if you go back to that previous slide about what we should be eating, like how many servings of vegetables a day, for example, and you look at what we're recommended or what we're supposed to be eating versus what we're actually eating, you can see that Americans have a lot of work to do when it comes to diet and nutrition. So if we look at the top bar of this graph here, the orange color is intake below the daily recommendation, and blue is intake that is at or above the recommended daily intake for that food. And so all the orange areas are the areas that we're really falling behind and not eating as much of. And you'll notice it's things like vegetables, fruits, whole grains, right? Like lean proteins. And if on the side where we're eating probably too much of it are the added sugars, the saturated fats, and the sodium. And so we're seeing this pattern where maybe not eating as much of the good food that we should be eating and eating too much of the food that's bad for us. So why do we eat the way we do? So a simple answer might be, well, hey, it just tastes better. I like salty food. I like the chips. I like the cookies, the ice cream. That may be part of it. There's a whole industry, right? Food science, where they engineer things and package them to be appealing and to taste good and all of that. And we've evolved as humans, when we're all, eons and generations ago, to be hunter-gatherers. We would pick those foods that were really high caloric and high value because there wasn't as much food and food was harder to come by. As we've become more sedentary and as food has become more widely available, those kind of natural evolution of what tastes good to us and what our bodies kind of light up when we eat is becoming a little bit disadvantageous because we're getting too many calories, too much salt. Another issue is affordability. And if you look at the way that our government subsidizes certain foods, it's not an accident that some things are cheaper than others, right? If you try to go to the dollar menu at a fast food restaurant, you're going to spend less money than if you go to a high-end supermarket and try to get a bunch of different vegetables that are fresh and make your own food. And so, there's certainly a component of that where we've had some lobbying from some agricultural industries to, make certain foods more accessible and cheaper. The other is a practical one, which is shelf life. So things that are shelf stable, cookies and chips and all of that, tend to have more salt, more fat, more preservatives in them. And then there's also the convenience factor. So what is near you? What's in your neighborhood? What's on your way home from work? And the distressing thing about the convenience factor for healthy food is that there are certain areas called food deserts. And we certainly see this in Chicago, where there may be neighborhoods where there is not a grocery store or there is not a farmer's market. And you're looking at getting most of your food from convenience stores or other places that don't have that fresh produce and things like that we need for a healthy diet. The other thing is fast food. So a lot of times that tends to be convenient. You can run through and grab it versus cooking the food at home on your own. Fast food tends to have a lot more salt in it, a lot more saturated fat in it than what you would make in your own. So we talked about this a little bit already, and this is just kind of in a graphical form here. And when you look at the triangle on the left, it shows a big area of basically federal subsidies for meat and dairy. And I'll add the caveat that one of the reasons it's such a big amount is it includes corn feed, which we then feed to cows and then turns into red meat. We really, as taxpayers, you and I, part of what we're spending on our government is actually subsidizing and making the cost of corn feed and these other animal products cheaper, so that when they put them on the market and they sell them, they're less expensive and more people buy them. And you compare that on the next slide here. We've got three. So we've got on the left kind of what we're spending as taxpayers to make cheap and make more readily available. The middle is what we really should be eating. And you'll notice that middle section, the green vegetables, is a lot bigger than what we're spending our money on as taxpayers. And then on the right is what we actually eat. And you'll notice that top part, the sugars, the saturated fats, the oils is really high. That little vegetable section is kind of a sliver. And so you see that we're making these choices, and the things that we're choosing to subsidize actually affect the choices and how people end up eating. So just food for thought there. Okay, so this is a slide that shows a map of food deserts within the city of Chicago. So the areas in red are areas lacking access to fruits, vegetables, and other foods that are needed for a healthy diet. And it's about 14.2% of Chicago that falls into that food desert categorization, where there's not a great grocery store, there's not a great food desert there. What I will note, unfortunately, is that there's about 400,000 African Americans living in Chicago in these food desert regions. So 77% is the percentage of Chicagoans living in the red area that are African American. So there's a disparity issue here. And the people that are living in neighborhoods that do not have access to healthy food, tends to be in these certain areas. You look at sort of the Austin neighborhood or some of the South Chicago neighborhoods. And so it's not evenly distributed, right? So the battle against stroke at home and abroad, we talked a lot about the US and our government subsidies and all that, but I'll also note that probably one of our biggest exports is just the American diet. And the rate of stroke has been going up considerably in the developing world. It's now I think the second leading cause of death in individuals above 60 years old. And the incidence of stroke is increasing. And they're predicting that over the next 2 decades, there may be a tripling of stroke mortality in Latin America, the Middle East, and sub-Saharan Africa. And if you travel, and we haven't been traveling with COVID, but if you do travel, you'll notice some familiar signage when you go around to other countries. A lot of our fast food industry, our restaurants have globalized, and even just the American palate, the things that, French fries and hamburgers and all of this have become more and more popular over time. Whereas alternatively, if you look at some of the traditional diets globally, particularly around the Mediterranean region, Spain, Italy, France, Greece, historically, there was a much bigger emphasis on eating olive oil, the fruits and vegetables, and then like the lean proteins and the whole grains. And they've been able to link a lower prevalence or a lower likelihood of high cholesterol and heart disease around this Mediterranean region, which is how they kind of got the idea to start studying the Mediterranean diet formally and looking at its risk on heart attacks and stroke. So they've done biomarkers, which means they draw the blood, they look at the components of it, and they found that people who eat a Mediterranean style diet have less inflammation in their body. They have reduced oxidative stress, which is, again, this other kind of pathologic process that can set you up for strokes and heart attacks, and also had higher circulating levels of antioxidants, which we've talked about before, decreases inflammation. You may have heard about antioxidants, things like blueberries and dark green leafy vegetables. And so all these different healthy diets, the Mediterranean one is the main one that probably had the most research on it. There's also the DASH diet, which was developed specifically for heart health and cardiac population. And I'm going to talk a little bit here in a few minutes about the MIND diet, which is a combination of the Mediterranean diet, the DASH diet, and then some emphasis on some sort of what I like to call superfoods that really have a lot of nutrients that may be particularly good for brain health. And we've studied these with food frequency questionnaires, so basically getting people to recount everything that they've been eating and really being able to delineate the dietary pattern of different individuals and then track them over time and see who has more heart attacks, who has more strokes, and other health outcomes. Again, the Western diet, this kind of classic like fried foods, red meat, saturated fats, and a lot of processed grains, so white bread and chips and crackers. The Mediterranean diet, again, this heavy emphasis on unsaturated fats, things like olive oil, and then a lot of kind of fresh whole foods, so nuts and fresh vegetables and fish, as opposed for the main protein source as opposed to red meat. DASH diet, the main thing, it has a lot of similarities to the Mediterranean diet, but there's this big emphasis on really cutting the sodium and making sure that it's a low sodium diet. And this MIND diet, which is the combo of the DASH and the Mediterranean, and then really an emphasis on berries, which have a lot of these antioxidants, particularly blueberries. And then also dark green leafy vegetables, so things like spinach and kale that really have a lot of vitamins and minerals. And then really trying to shy away from the red meat, the saturated fat, cheese, hard cheeses, and a lot of the sweets and processed. I will tell you that for the Nurses' Health Study, which is a ongoing study that's been running for years and years, they took a group of nurses, enrolled them, and they said, okay, we're going to follow you. We're going to ask you questions. We're going to look at your health records every year for 5, 10 years. So it's been going on for a long time. And they've tracked based on what they're eating and how many of them ended up having various health conditions. That when they combined it with being a non-smoker and getting good physical activity, which Devlin is going to talk to you more about in a minute here, the analysis suggested that the Mediterranean diet, eating a healthy diet and good nutrition, could cut your risk of coronary artery disease by 80%, could cut your risk of stroke by 70%, and it could slash the risk of type 2 diabetes by up to 90%. So, pretty profound benefits for trying to eat a healthy diet. I'm going to go through a little bit quickly through some of these because they're a little bit technical, and these are like scientific journals. But it's basically saying the same thing again. This is Regards, which is another big academic study that's gone and looked at focused on the southeastern U.S. So remember that slide I showed earlier that had the map with the stroke belt with all the dark purple? This is a study that's tracking that population of people. And they found that a Mediterranean diet was able to reduce the risk of ischemic stroke by 21%, right? So it's like if you had 5 people, it's like 1 out of 5 people, you could spare them having the stroke by eating a healthier diet. The Framingham study, which takes place kind of in the Northeast, like New York area, followed middle-aged men for 20 years. And they looked at the an inverse association between fruit and vegetable intake and the development of stroke. So similar findings, right, in a different area of the country. They found that people who were eating at least 3 servings a day of fruits and vegetables had a 22% decrease in their risk of stroke. So again, you're cutting that by a substantial amount by eating the healthier foods. This is just a graph kind of showing the same thing. This top line up here is the kind of first quintile, so people are eating a less healthy diet. And then the bottom line, the 5th quintile, is the ones eating a really healthy diet. The others are kind of in between. And you're looking at how many of these people end up having a stroke as the years go on. And the people with a healthy diet, much less likely to have a stroke over 10, 15, 20 years. The same thing with the Lyon Heart Study. So this was done in another country. They were looking at Mediterranean diet versus a Western diet. And they looked at kind of a composite outcome. So a combination of stroke, heart failure, blood clots. And they found that they had a big reduction in any of those events in the group that had a healthy diet. So including, stroke outcomes. So this is, again, just a graph here showing these lines separating with a healthy diet having a much lower risk. Okay, so then PREDIMED was a study that happened in Spain, and they were really focusing on giving the participants the food. So not just saying, you should eat this way. Here's what we recommend. I'm a doctor, here you go, and here's the food you should eat. Actually giving them food like a prescription, like you would get your cholesterol pill or your other medications. They actually gave these people olive oil and nuts and these ingredients that they really thought would be beneficial for their health. And then they compared them to a control group and monitored them over time. So this idea, kind of going back to that Hippocrates slide of food is medicine. Can you actually give people healthy food and prescribe it to them in the way that you would prescribe medications? And they were able to really see a decreased risk of stroke over time in that group as well. So some benefit to actually maybe giving the folks food. And I'll talk a little bit about how that ties into us here at Rush towards the end of my talk. So again, secondary stroke prevention. So let's say you've already had a stroke and you think, you know what, I've been eating hamburgers and cheeseburgers my whole life. The damage is done. There's nothing I can do, right? The stroke happened and it is what it is. My brain's had all this wear and tear from the bad food and bad lifestyle. Not true. After you've had a stroke, it still matters. So if you make these healthy choices and you eat healthy food, you can lower your risk of having another stroke. And we know it's important because of people who have one stroke, 30% of them, 1/3, will have another stroke within 5 years. So it's a high risk group. It's basically that first stroke, your body's telling you it's capable of having a stroke. It's at a high risk for it. So you really, really want to make sure you're doing everything in your power to prevent that from happening. And especially that first year after the stroke is where kind of the biggest risk is. 15 times the risk. If you said let's say you've got a 65-year-old woman who has a stroke, 65-year-old woman who's never had a stroke, the person who's already had one stroke, 15 times higher risk of having a future stroke. So, again, we're looking at all these components because what's going to prevent us from having a secondary stroke? All these things we've already talked about, right? High blood pressure, diabetes, control of cholesterol, and all of these things have a dietary basis, and lifestyle is just as important as a lot of the medications. I'm going to skip over this study here, but it's basically just saying the same thing, that you can basically combine it. So it's not saying I'm going to eat healthy and not take my medicine. What we're really going for is sort of a synergistic or a cumulative effect where you take the medicines and then you also change your lifestyle together to maximize your benefit. This slide I think is kind of interesting. This was a study that talks about statins and how effective actually is this in terms of cutting stroke risk. And the statin medications have been a game changer. When you look at people who historically would have had heart attacks and strokes, they've been phenomenal at cutting the risk of stroke. And really eating this healthy diet with fruit and vegetable consumption may have an effect that's equivalent to a statin. So imagine you do both. You take your statin, but you also make those healthy changes. So instead of eating this sort of fast food diet and then just popping a pill at the end of it, if you actually take the medicine and then make the changes, you're going to potentially have an increased benefit. So the part about neuroimaging and neuropathology. So we've talked a lot about outcomes, cutting your risk of stroke, getting those vascular risk factors under control, and using diet as sort of a superpower to help you do that. When you actually go in and you take a picture of the brain, or after somebody dies, you can go in and take an autopsy and you look on a cellular level at what's happening, you can see that the people who are eating the healthier diet have a much lower risk of having the degenerative changes, so wear and tear from stroke. So there was an MRI study in the northern Manhattan, again, it was a New York area study, that showed that there was fewer white matter hyperintensities. And white matter hyperintensities kind of mean like the wear and tear. So it's like you accumulate it with a breakdown. And the people that were eating the healthier diets had much less of that sort of age-related changes that you see kind of accumulate from long-standing hypertension. Looking at the MRIs of 700 people in their 80s, they found that people who followed a Mediterranean-style diet were up to 36% less likely to show brain damage from small strokes. So sometimes you have these little tiny strokes that you don't even necessarily get symptoms from, but over the years you can accumulate them, and it can raise your risk of dementia and falls and all sorts of other things. So they were seen at a microscopic level, fewer strokes in the people eating a healthy diet. And then finally, there was another study looking at eating a healthy diet and it being associated with less brain atrophy. Atrophy means kind of like shrinking or shriveling down like a raisin. So basically, it was equivalent to 5 years worth of aging. So imagine that. It's like you're eating healthy and you're essentially, instead of being 70 years old, your brain looks like it's 65 years, right? So you're having this delayed aging effect going on by eating the healthy foods. So, and then just for those of you who have the video here, these are representative differences. So the brain on the left is a normal, healthy brain, and it's kind of nice and plump. You can see kind of normal structures there and not a lot of streaky white abnormalities. The brain on the right side, you'll notice these bright white kind of fingers going up, showing that what we call white matter hyperintensity or degenerative changes. And you're also seeing a lot of atrophy. So when you look at the kind of black squiggly areas, and they almost look like canyons on the right side, and that's because the normal plump, nice, healthy brain tissue is starting to shrivel and shrink with aging and with degeneration. So obviously the goal as we age, we want to be more like the brain on the left side and not as much like the brain on the right side. So again, this is another kind of technical study, but again, looking at, can we quantify this? Can we actually go in and scientifically measure how much brain tissue there is and how it looks based on the dietary pattern? And again, they're finding they actually go in and mathematically calculate out how much healthy brain versus unhealthy brain there is. There seems to be a clear correlation to the dietary intake in the healthy diet. And then finally, and I think a really important component of all of this is that diet is useful for preventing more than just stroke, right? So when we think of strokes, obviously we think about being paralyzed or not being able to have sensation on half of the body, maybe having trouble talking or trouble understanding people. But there's a lot of sequelae, a lot of outcomes from stroke that have to do with our mental health, and have to do with our memory and cognition, which really I think plays a lot into who we are. And so trying to combat depression and combat cognitive decline are difficult things. I think there's not an easy fix for these. And so that's why lifestyle modification and having some ability to try to intervene and either prevent or decrease these symptoms of depression and cognitive decline are really important. We've looked at people, there's almost 4,000 people with stroke or transient ischemic attack, which is like a mini stroke. And they were basically able to find that about a third of them had symptoms of depression and anxiety after their stroke. So 20 to 30%. So it's really common. Like 1 out of 3 people with a stroke are going to have some of these symptoms, and it can really affect your ability to recover. Because imagine if you're really depressed and you're trying to do your therapy and you're trying to work on getting your strength back, but you just feel flat and you feel down and you don't want to do it, it's going to affect how much you're going to be able to recover. And so that can be something that actually affects, are you able to go back to your normal life? Are you be able to interact and do the things you like to do? And there's some sense that women and people that have strokes when they're younger are more prone to this. Let's see here. So the thing I'll point out from this slide is that at 15 years post-stroke, some of these symptoms still linger. So it's not just in the acute phase after the first couple of months where people are feeling down and depressed. Long-term, possibly related to some structural changes in the brain from having the stroke, these symptoms can linger. And so certainly people with a pre-existing history of depression may struggle with this, but even people who historically didn't have any mental health problems may struggle with it after. This is a screening tool, and we basically try to check all of our patients and think about this whenever somebody has a stroke. And we'll kind of screen for it and hopefully treat them. Now, there are a lot of good medications that we can give people to try to help, SSRIs and other things, Paxil and Zoloft and all of that. But sometimes it's not enough. And oftentimes there may be interactions with other medications. People may decide, I just don't want to be on this medicine, or I don't like the way I feel on it. They may be expensive. And so there can be some drawbacks. Even though these medications for anxiety and depression can be really helpful, they may not work for everybody. And the same thing with therapy, which is wonderful, but it's also can be very expensive and not everybody has access to it, or they may get a certain number of sessions and then it runs out. And then exercise has been another good thing in terms of helping with the mood and preventing depression. But some people may, if they're having significant disability from their stroke, may find it difficult to exercise. Or, we're in Chicago in the middle of the winter, it may be hard to get out. Some of my patients live in neighborhoods where they don't, it's not as easy as it sounds to go out and take a walk around the block after dinner. And so having something in addition to our usual tools, something like diet to try to prevent post-stroke depression is really important. And then finally, we'll talk a little bit about cognition. Now, I mentioned earlier that after having a stroke, the risk of dementia doubles, right? So there's a high risk population, and what can we do to try to prevent that cognitive decline after stroke? Well, there's currently very limited treatments for dementia. We have a few medications that don't work super well, and it can be a very debilitating thing. It's one of the main predictors of, are you going to be able to live independently? And as you can imagine, if you're the spouse or the child of somebody that is struggling with cognitive impairment or dementia, it can be really stressful because this person who was always independent and maybe took care of you when you were younger is now having difficulty doing daily tasks and maybe can't even be left alone. And so there's a lot of caregiver strain associated with cognitive decline and dementia after stroke. So this is where I mentioned the Mediterranean/DASH intervention, the MIND diet, which actually was invented here at Rush with this focus on what is the things that we should eat, what's the nutrition, the dietary pattern that's going to really optimize brain health. And so this is a study that was done here, and we looked at the MIND diet, highest tertile, meaning people who really ate this diet pretty religiously. And the people in the lowest tertile were kind of your typical Western American diet with the hamburgers and the chips and all of that. And at the end of this study, they would put them through basically a half day of testing. There's 19 different cognitive tests. And they sat the two groups down and they went through their testing. And the group that was eating the MIND diet was getting scores as if they were 7.5 years younger than the control group who was eating the unhealthy diet. And so it's really profound, I think, because it's showing that having that nutritional support seems to be able to help the brain function at a high level, even as people age. So this is not in stroke survivors, by the way. This is just in the general population. So even for people who've never had a stroke, there seems to be this benefit for nutrition in preventing cognitive decline. So when we look at this kind of globally, there's some structural challenges to eating well in this country. Do you live in a food desert? Why is junk food cheaper than healthy food, right? But it's definitely worth the time and the effort to, on a personal level, make those good choices for yourself and your family. Even if it is a little bit more expensive, I think to prioritize buying high nutrient foods and really taking the time to cook the food yourself and make sure that it's low sodium and you're getting all the nutrients that you need. We've gone through a large body of evidence. I've barely skimmed the surface of it in this lecture, but showing that there's a role for nutrition, both in preventing a stroke from ever happening in the first place, and if you've already had a stroke, from preventing another one from happening. And then there's also this evidence that there may be a role for nutrition in preventing depression, anxiety, and other mental health disorders, as well as cognitive decline in the general population and also in the stroke population. So I think this is applicable to all of us. And then in particularly, if you personally or family members have had a stroke, I think it really highlights the importance of taking nutrition seriously and really treating it like part of your treatment regimen, the same way that you would treat taking your other medications. So I'm going to transition things over to Deb Lynch here, who's going to talk about the role of exercise in stroke prevention. And then we'll stick around for the end of this and have a Q&A session with all of you if you have anything you'd like to ask me after the lecture. Thank you so much. Appreciate your time.
Great. Thank you, Dr. Cherian. That was great. And then, Deb, if you want to go ahead and share your screen, we're ready for you.
Good afternoon, everybody, and thanks, Dr. Cherian, and given a great overview on diet. And I didn't know that DASH or MIND was actually done here, so that's very interesting. And thank you to our Rush Generation team who've given us an opportunity to talk about stroke prevention, especially during this month of stroke awareness. So I wanted to talk about physical activity and exercise. Again, it goes hand in hand with diet, of course, as a modifiable risk factor. And I want to start with asking you all, are you fitting in at least 150 minutes, 2.5 hours of heart pumping physical exercise every week? If you're not alone. Only about 1 in every 5 adults and teens gets enough exercise to maintain good health. So today we'll talk about physical activity and exercise related to good health, stroke prevention. And I want to start with looking at, once again, the modifiable risk factors for stroke. So we have high blood pressure, diabetes, this high cholesterol, obesity is here, cigarette smoking, atrial fibrillation and heart disease. But last on this list, but not least, is physical inactivity. So it's one of those things that we really can't focus in on. It's something when I see patients in the clinic that I put a lot of time and energy into trying to figure out something that may work for that person. Trying individualizing it to them. Kind of a busy slide here, but the definitions, basically, you know, we hear of physical activity and oftentimes I'll hear from people, well, I'm really active, or I'm really active at my job, doesn't that count? So, you know, both physical activity and exercise relate to voluntary movements that we do, and it burns calories. But physical activity is everything. It counts for all your movement of the body. It does burn calories, and exercise is a part of that. So the difference between the two is that exercise is one of these kind of structured activities. It's usually repetitive. Oftentimes it's aerobic, and including jogging, biking, but not limiting to all of the things listed here. Aerobic activity is when you get your heart up, and it really benefits the heart by improving the cardiorespiratory fitness, really endurance when we look at that, and we'll talk a lot about that in a few minutes. So So how does physical activity and exercise actually reduce stroke? You know, Dr. Cherry was talking a lot about the foods that we eat, and especially, you know, when we have high salt diets and how that contributes to high blood pressure. Physical activity and exercise is a little bit different. We think that it improves the blood vessels, the function of the blood vessels. But most importantly, I think that it really attacks a lot of the other stroke risk factors that we were just talking about. So if you do exercise regularly, it can benefit high blood pressure, high cholesterol, diabetes, excessive alcohol consumption, smoking. It also increases, if you're familiar with our lipid profile panel, when the doctors talk to you about cholesterol, they break it down into your bad cholesterol, the LDL, and the good cholesterol, the HDL. So exercise, we know, increases that HDL, and it also increases blood flow. So specifically, it maintains function of cells that line the blood vessels. They're called the endothelium, and this layer makes a substance that allows the blood vessel to open wide when we need more blood flow. It also protects against atherosclerosis, or I usually talk about it very simply as like rust buildup inside your pipes. When we exercise, muscles need more blood. So during regular exercise, when we do this repetitively, we grow more blood vessels. And people who exercise regularly tend to have increased blood volume. Their blood flow is increased by strengthening, and it strengthens the heart and blood vessel. And this leads to a kind of a filtering in of waste products in the liver. So many things that, you know, we keep hearing, oh, exercise is good, you got to stay really active. But we really know now at the, you know, what's going on in the body, that it really is helpful, not just for, you know, lowering risk factors, but also we found kind of another product that it helps really reduce stroke. So when we look at these risk factors, high blood pressure, how does it improve that? So we think that it's because the improved blood flow after exercise. With diabetes, we know if you exercise regularly, it can help lower your blood sugars. It can also redistribute this fat distribution that we know goes along with diabetes. Excessive weight, it has minimal effects on weight. You know, you can't really have a good exercise program that's not super strenuous, that you're gonna lose a lot of weight, but it also changes or associated with improvements in how our body looks, this waist circumference, and also body fat. So I have a few studies here that a lot of, and some of them are the same that Dr. Charon is talking about, but most of the evidence for physical activity and exercise and stroke has to do with these large groups of people that are studied, and to see, you know, do they have more or less strokes if they follow what we consider a healthy lifestyle. But knowing that a healthy lifestyle not only includes, you know, good nutrition, good activity, or lots of activity, there's so many things that go into it. It's often hard to kind of pull just activity out from all these studies. But things, the two boxed area here, the two things that are shown throughout is that if people have this moderate or are highly active, they have lower risk of stroke incidence and lower risk of mortality than those people that have a low level of activity. And stroke risk can be reduced with regular exercise in people of all ages. It's not just the young. Just like dietary changes in your 70s makes a difference, so does physical activity no matter what age and in both sexes. So one large trial, this is a 10-year trial looking at 16,000 healthy men, and they had a high fitness, considered a high fitness group. They had 68% lower risk of stroke and death compared to those in the lowest risk. Now, you'll see with these trials that what they are looking at is different. It's not like, okay, everybody has exactly the same definition of what low risk, high risk is. So we'll be looking at that and paying attention to that. Here's that nurses' health study. A lot of people in these trials. So it showed that the adult women who make healthy lifestyle choices have 80% less risk of total stroke when compared to those who don't. For men, it was a little bit lower at 70%. And in this study, the optimal amount of physical activity with a healthy lifestyle was defined as over 30 minutes a day of moderate or vigorous exercise. In Sweden, another large trial, this is 31,000. The definition of healthy level of physical activity included both low and moderate intensity activity, walking or cycling at least 40 minutes a day, and completing at least an hour of structured exercise. The risk of stroke decreased with the addition of each lifestyle factor, and women who adhered closely to all these factors had a 62% lower risk of stroke than those who had low. And finally, a China study was also very large. The individual factor of physical activity. So they're looking, trying to look specifically at this, compared one group to another, and the moderate to vigorous activity of over 80 minutes per week versus the non-ideal showed a significant lowering of total ischemic stroke, but interestingly, not hemorrhagic stroke in this population. So some takeaways. All men, studies of all men or women participants generally concurred that some physical activity compared to none offers protection against stroke. The higher the physical activity levels are associated with significantly lower risk of stroke. And this other kind of separate thing, physical activity seems to have a protective benefit in stroke prevention beyond the traditional stroke risk factors. All right, so what about physical activity after stroke? This is what Dr. Charin was talking about as secondary stroke prevention. There is evidence that, this population, people that have had a stroke and are, rehabbing and trying to recover and bringing up their levels, they tend to have a less physical activity than the age match group, and the intensity of their activity is also less. Also, previously mentioned by Dr. Charin, depression and fatigue, low motivation also decreases desire for physical activity, kind of a cyclical thing. But there is also evidence that exercise after stroke, or TIA, results in improvement of the ability to exercise better, and it decreases those stroke risk factors. A systematic review of a lot of trials showed that there's also significant improvements in blood pressure, fasting sugars, and the HDL, that good cholesterol, for people who've had a stroke and have included greater physical activity into their regimen. So getting started, I think the biggest thing is, besides decreasing, the diseases and management of those diseases and prevention of future, we have the benefit of having physical strength and the ability to do things that you want to do, improving your balance so you don't fall, and also decreasing feelings of depression. So you can see a lot of it goes hand in hand with the diet changes. So these are real simple, but to include physical activity in your everyday life, you have to make it a priority. It has to be easy. Some people like to exercise by themselves, but it offers a social aspect too. With COVID, it's a little bit different, but there's still people that have walking groups, even with our surges, that had, walking on the streets with their mask on and 6 feet apart. I think if you can make exercise interesting and fun, it's a much more good chance that you're going to do this regularly and making it an active decision. So there's 4 types of exercise that I think we have to keep in mind. It's not just one. So if you can incorporate all 4 of these, it's most beneficial. So endurance, strength, balance, and flexibility. You also have to plan for breaks. Life happens, even the best athletes, there are things that happen and they pull a muscle, or they they have tendonitis. So things are going to happen, and maybe it's something personal that's happened that you just can't exercise. But know that when you're ready to exercise again, it's good to start about half of what you were before, and to start slow and to progress to back where you were. The Heart Association guidelines, and these came out a couple of years ago, the minimum of 150 minutes a week of moderate intensity exercise, or 75 minutes a week of vigorous aerobic exercise, or a combination of the two. And like all exercise, it's really preferable that you're not just a weekend warrior, but spreading it out throughout the week. If you add muscle strengthening with resistance or weights, it should be done at least a couple of days a week. That's going to help with your overall strength. Spend less time sitting. Even light intensity activity can offset some of the risks of being sedentary. So even though you may only be able to walk, and maybe walk slowly, maybe it's at work and taking a break and walking with friends, that's better than nothing at all. So it's really important to know that anything really helps to promote good health and also decrease stroke risk. The gain is even more when you add at least 300 minutes a week of exercise. So it seems like a lot when you count up 300 minutes, but it's only, if you spread that out over 70 days or 7 days, you're looking at a lot less time. So increase the amount and intensity over time. So start slow and move on. If you haven't had an exercise routine, it's always good to start on the slow end, but to keep monitoring it and keep moving in a positive direction. So here's the first area. So endurance. Most inactive people get less than 5,000 steps. If you're following your steps, and here we are in this pink Fitbit, it has 10,000 steps. So that's pretty good. So inactivity is really considered less than 5,000 steps. But wherever you are, to build on that is most important. So aerobic exercise, and that's what endurance is all about, is aerobic. So you're breathing through these exercises, your heart rate goes up, you're going to improve your fitness, your overall fitness, and delay or even prevent diseases with increase in your endurance. It'll also, when you take a look at your life and how it impacts your life, it makes it easier to, if you have grandkids, to push them on a swing, to vacuum the house, to rake leaves, to do things that are part of our life. And sometimes if we don't, as we age or have a disease, then sometimes the endurance kind of falls to the wayside. So building endurance is super important. And I think this is really where to talk about what these aerobic exercises are. This is definitely not a list of all of them. So brisk walking is moderate exercise. Water aerobics, dancing, not like hardcore dancing where you're sweating, but ballroom or social dancing, gardening, playing doubles, tennis, biking, and interesting, slower than 10 miles per hour. So the American Heart Association is saying, get at least 150 minutes of moderate intensity exercise a week. So this would be the list that gives you an idea of what that would mean. Vigorous intensity aerobic exercises, the difference is really you have, you're breathing harder, breathing so hard during these activities, you really can't carry on a real good conversation if you're with somebody. You also get really warm. Most of the time you sweat. So you can see, again, these are not an end all of vigorous activities, but hiking, running instead of jogging, or walking, swimming laps, aerobic, dancing, heavy yard work, singles and tennis, and biking at a faster speed, jumping rope would also be vigorous activity. Again, the American Heart Association recommends a minimum of 75 minutes of this type of aerobic exercise every week. The second main area is strengthening. If we go back to the American Heart Association recommendations, they say, add 2 days a week of strengthening, for 30 minutes at a time. I think when you start, if you haven't done anything, you don't want to pull muscles. So it's always better to start with very light weights, 1 to 2 pounds of weights if you're using hand weights. But in these pictures, you see a variety of different things. This woman over here on the left is carrying a dumbbell. It's a very light dumbbell. I'm not sure what this is. It looks like a tube, but I don't know if it has weights in it. Here's a actual flat weight. This woman has her hand weights. And over to the right, you can see the people over on the right screen are using resistance bands. These are great. And I think that so much easier to, you can go on to Amazon and get a packet of 4 different resistance bands that look similar to this. And you can start with almost no resistance and build that up. Even a small amount of increase in your muscle strength can make a big difference in your ability to stay independent and carry out your activities of daily living. For instance, like carrying a basket up to the 2nd floor, or carrying a smaller grandchild, or an animal or a pet, lifting bags of mulch. So again, things that we take for granted, and all of a sudden there's a point that you don't feel like you're strong enough to do that. So these are things that to think about when we're adding strengthening to our weekly regimen. So here you have, again, the picture of resistance bands up on top. This is a typical hold for the bands if you use a flat band, but resistance bands can also come with a handle. So it's really your choice, whatever you feel most comfortable with. These are flat. The ones with the hand grips are usually tubular, but they're also vary on how much resistance is in each band, and it's usually designated by color. You don't have to have hand weights that you buy. You can also use cans of soup. Usually cans of soup are 10 ounces, so you have less than a pound in each hand. So that's a great way to start. The woman on the right has a very lightweight hand weights, and these are like 2 pounds. So I'm going to give you some examples. So these are strengthening exercises, and we're going to go from the top down. This is that tubular hand grip resistance band over on the left. This woman is seated in her chair, and she's bending her arms. So she's actually strengthening the biceps. You're supposed to hold this, bend your elbows, you hold it for a second, and you release that down to a resting position. All of these strengthening exercises, you repeat like 10 or 15 times, which is considered 1 set, and you repeat them times 2. The gentleman over on the right, these are actually called wall push-ups. So again, you don't have to go on your hands and knees to do a typical push-up. You can use the wall as the resistance, and you stand back and then you bend your elbows, and that's considered 1 push-up. You repeat it times 10 to 15 for 1 set, and repeat it also times 2. This is a great exercise. I think that when I see people in my clinic, and I ask them to sit down, but I also am paying attention to how they get up from a seated position. You can see with this gentleman, he has his bottom on the kind of the lip of the chair. His legs are bent, his arms are straight, and he's using his quadriceps, his thigh muscles, to lift himself up into a standing position. Again, these are exercises that should be done 10 or 15 times for 2 sets to build this strength. This is so good. This is such a great exercise for prevention of fall. This is a little bit harder. So with the arms on the chest, it's the same thing. He would not have his arms for stability, and using the quadricep, the thigh muscles, to lift himself into a standing position. The front arm raise is for strengthening, and these are light weights, and you would just have your arms in a relaxed position, lifting them up like this. This is good for the shoulders, and to hold for a second and then relax. Repeat 10 to 15 times for 2 sets. Here's our lady, and she's in a chair dip. So just using your any armchair. So holding on to the arms and pulling yourself up and lowering yourself down. This is great tricep movements, so really good arm movements and good strengthening. Again, repeating it 10 to 15 times and with 2 sets. This gentleman has his raising his back leg. Now he's actually wearing weights on his ankles to make it even harder for him, but I wouldn't recommend that if you're not doing this regularly. But for stability, he's using a chair and lifting one leg up, holding it for a second and putting it back down and repeating that 10 to 15 times, then reversing to the other leg and doing both of those for a total of 3 sets. Our lady here is a side leg raise. It's very similar to the back, but it's over to the side. So lifting it to the side in a straight leg position, holding it and bringing it back down in a similar fashion to the other exercises. The knee curl, this is really good for the calves. So you're standing on one leg and bringing your opposite leg up, bringing it back down and repeating that 10 or 15 times. Using the chair for stability. I think this is a great way to, if you're not exercising regularly, to use a chair, using something for support for a bit of time until you feel like you're stronger. Our leg strengthening. So this is nice because you can just do the same exercise, but you're now in the seated position and lifting your leg up, holding it and bringing it back down and repeating it with the other leg 10 to 15 times for 2 sets. And lastly, on the strengthening are the toe stands. So really good for the feet. Often we neglect how important it is to have strengthen the feet. So this is a great strengthening exercise to do, again, on a daily basis for strengthening and at least 3 or 4 times a week. So balance, we talked about endurance, we've talked about strengthening. Balance is important, and it's something that, we don't typically think of unless you are really into yoga, maybe even Tai Chi. A lot of those are great social classes that focus on balance. Certainly, if you have good balance, the risk of fall is so much less. So think about balance opportunities for you to, if you have good balance, you can get on your tiptoes and reach something on the top shelf. Maybe you can walk up and down stairs without holding on to the railing, or even walk on an uneven surface. And certainly in Chicago, we have that with our potholes, but also with ice during the winter months. So we're not going to go through, each one, but I want to tell you that these are done holding for 10 seconds. So it's a little bit different. So you have a hold that's a little bit longer and you repeat 10 to 15 times. So this is standing on just one foot. You can see once again, this gentleman is using the chair for balance to start. Now, when you look at this lady, she's doing a heel to toe. And the way you would do this is kind of look forward and making sure that, you're doing heel to toe, just like walking the line, 10 steps. And then if you get really good, then you can do 10 steps backwards and then start increasing to 20 steps forward, 20 steps backwards. And this is actually marching, so this could help. So you're bringing one leg up into a really high position, putting a lot of weight on your one leg, and then bring it down, and you can keep doing it on one leg for 10 or 15 reps, and then you do the opposite leg. And lastly, but not least, flexibility. I think we think of it mostly as stretching. Stretching exercises can help you stay limber, which gives you a lot more freedom of things you want to do, like looking over your shoulder to see what's behind you when you're looking in the mirror while you're driving, making a bed, bending over, and tying your shoes. All of those things take flexibility and a sense of being very limber to be able to move the way you want to do. If we start at the neck, just turning your head to one side. And this time for flexibility, each one of these exercises are a hold for 10 or 30 seconds, and then turning to the opposite side and doing the same. It should be repeated 3 to 5 times for the stretch. This is great for, your shoulders, your upper bodies. It can really help you reach for your seat belt. So you can see that this woman has just a regular towel that she's folded. And in the first position, you can see that the right arm is above her head. The left arm is about her waist level. And then on the picture on the right, she's pulling it down using the left arm so that it's a stretch. This is a great exercise. Here's flexibility of the shoulders. This guy is actually standing against the wall. I don't know if you can see it, but it helps improve posture. So you're touching the wall behind you. You feel the squeeze of your shoulder blades. You drop the arms forward, still touching the wall, and feel the squeeze in this position. Great shoulder exercises. You hold these again for 10 or 30 seconds and repeat 3 to 5 times. This doesn't really do it justice. You can't see it because it's not moving, but this is helping the flexibility of the upper back. Great for the shoulders as well. So it's a seated position, reaching forward. So you're comfortable, you move your arms upright, but now you actually reach as far forward as you possibly can. And again, the same routine of holding for 10 or 30 seconds and repeating. For the upper body, this flexibility is, you can see a lot of these are really things that you can do just at home. This will help you reach for those items on the top shelves. That's great for the upper body, the arms, your chest. You walk the hands up the wall until your hands are above your head, and you hold it as high as you possibly can. The goal is eventually to reach as high as possible. This exercise is great for your posture. So moving your arms back, so you bring them back out to the side, bring your arms totally back, and you squeeze the shoulder blades together. Have that a hold for 10 or 30 seconds and repeat 3 to 5 times. The back of the leg, hamstrings for me have always been a problem, especially my left one. So really stretching out the hamstrings for me is important. You grasp your one leg. You can see this lady is on her mat. So grasping the right leg with both hands and then pulling your leg forward towards the body. Great stretch. Do it one leg and then the other, holding for 10 or 30 seconds and repeating 3 to 5 times. So here, again, she's on the mat, she's on her side, and this is kind of a hard one if you aren't flexible to begin with. So to be able to grab your leg with your hand can be hard. So you can use either a towel to help you pull it up, or if you have resistance bands, to use that around your leg so you can pull it up. And that really stretches that front thigh muscle really well. Again, similar hold. Flexibility for the back. This gentleman is seated on his armless chair. He's bending forward, but this exercise is bending forward and continue to bend forward, sliding your hands down your legs. And the goal is eventually to be able to increase your flexibility so that you can reach your heels or even the floor underneath you. Flexibility of the hip and lower back. This is a problem for a lot of people. And for the gentleman on the left, this is working the hip and the inner thigh. So bringing both knees up, one leg you're going to lower and bring it out to the side, holding it again. That's where you're getting the stretch, holding for 10 or 30 seconds before repeating, and then the opposite leg. The woman on the right, we're really looking at a lower back stretch with the knees up, and moving the legs together. So in a flex position, moving the knees together from one side, holding it, bringing it up to the neutral position, and then bending to the opposite side, and then repeating 3 to 5 times. Don't forget the ankles, very good, just like your toes on the strengthening. So bringing your heel in front of you and then bring your toe up, pointing your toe as high as you can towards you and holding that. And something kind of fun, if you have a buddy that you're working with, this is a good overall stretch, good for the shoulders, the arms, the back, and the legs. These two ladies have attached two bands together. Their feet are touching, and one woman is bending backwards, making the other woman stretch forward, and then they go back and forth. As they progress, you can, or as you progress, if you're doing this exercise with friends, you can increase the resistance band strength. And some people actually get to a point where they can just hold hands and do the hands and bending back and forth. So great off overall. If you're just starting, or even if you've been exercising but you want to really focus in on improvement, I like to use a log. This is a 7-day log, and it breaks it down into your endurance, upper body strengthening, balance, and flexibility, so you can kind of see what you've been doing and where you are right now. So these are some of the things that, when we look at exercise and stroke, we know that physical activity of any sort is going to help with reduction of risk factors. It's going to help your overall mood. It's going to help with fatigue. And you don't have to start by doing everything that I just went through, but it's nice to have some ideas of good exercises in the 4 areas: endurance, strength, balance, and flexibility. Try and incorporate some of those into your weekly regimen, and shooting for that minimum American Heart Association guide of 150 minutes for endurance a week, or 75 of vigorous activity, and building from there. So that's all I have for right now, and I think that we'll turn it over to Jasmine for any questions and answers. And thank you very much.
Wonderful, thank you. That was great. You helped me get out of my chair, and I did some moves too, so thank you. Thank you both. So we have a couple of questions online already. We're going to start with those of you who are on the phone. So if you had any questions, you can go ahead and unmute yourself and ask now. And to unmute yourself, you can press *67. All right. So we'll go ahead to our online questions. And then after that, for those of you over the phone, you'll have another opportunity to unmute yourself and ask a question or share a comment. So the first question, can you reverse brain atrophy? I think that's for Dr. Cherian.
Yeah, I think that's a good question. I think the jury's a bit still out on that. Most of the studies that we have look at progression over time. There are some studies looking at the statin class of medication and the buildup of atherosclerosis or plaque in the brain that shows that that may be able to improve over time. But atrophy, for most of the data we have right now, once that's kind of shrunken down and done, it probably is permanent, although I'd love to see, studies in the future looking at that. I think the idea is, how do you preserve what you have? Because it's obviously a lot easier to do that than to try to reverse it.
Thank you. And then the last question we have online, can light exercise that doesn't make you sweat still reduce the chance of a stroke?
Yes, it sure does. Any exercise that you do, any physical activity, we're not meant to be seated. We're not meant to watch TV all day long. As human beings, we need to be up and moving. And I think anything that you do is going to have a very beneficial, you're going to find it really beneficial in your overall life, and hopefully mood as well. So you don't have to be a an Olympic athlete, but to start small and to increase up. Yeah.
I always say one of my favorite exercise studies too was one that looked at weight loss and exercise, and it said even if you don't lose a pound, so if the scale stays exactly the same, you still get all these other benefits from it. So when I talk to patients about trying to make these lifestyle changes and get healthy, it can be frustrating if you say, okay, I'm going to start doing all this, and then the scale doesn't change, but maybe the muscle mass goes up, and you have a lot of these other improvements too. So yeah, every little bit helps.
Thank you for sharing that. That's great. Okay, so then we'll have one more opportunity for those of you on the phone. If you have any questions or comments, you can unmute yourself now by pressing *67.
Hello?
Hi. Yes, we
Yeah.
can hear you.
First of all, can I go on?
Yes.
Okay. First of all, I want to thank the Rush Generation group and the speakers. Good job. Thank you much. We appreciate that. Now, I don't know where I heard this from. I heard that if you have a stroke, maybe around 50 and 60s, you are more likely to die from it than the people having it at 80 or 90. I don't know where I heard that. Is that true?
Well, I think part of it is if you're having a stroke at a younger age, that may indicate that you've got a lot of these vascular risk factors that are not well controlled. But in terms of, if you have a stroke when you're younger, will you die within a year, as opposed to that? I'm not aware of any data that would suggest that. I think in general, when people have a stroke older, it may be from kind of wear and tear, and there may be more aging related changes associated with that. But I think your risk overall of dying, if you have a stroke when you're 85, I think your chances of bouncing back from that and recovering, at least what I've seen in my patients in my practice, younger patients have a little bit better potential to bounce back or recover.
Great. Thank you for your question also. Anyone else over the phone, if you want to ask your question, you can ask now. All right. Thank you so much to Dr. Cherian and Deb. We're so grateful that you shared your knowledge with us. Thank you for all of our participants for joining. We're going to go ahead and share some of our upcoming programs. So I'm going to go ahead and share that now.
I have to go out.
All right. All right, so first and foremost, for those of you who want more information on the COVID vaccine, so whether you're looking for more information about it or if you want to schedule an appointment, you can go to the Rush website, which is rush.edu, to get more information. Next, we have our Take Charge of Your Health workshop. This is on Tuesdays from May 4th till June 8th, so there's still time to join, from 10 a.m. to 12:30 p.m. So this program and many of our programs will be taking place through Zoom, so that's online. But if you're interested, but you haven't gone on Zoom before, you're not very familiar with it, that's okay. Our team can help you get adjusted and feel comfortable with that before the program. So if you're interested in the Take Charge of Your Health workshop, again, Tuesdays, May 4th until June 8th, from 10 a.m. to 12:30 through Zoom. You can register by calling our toll-free number for Rush Generations, which is 800-757-0202. We also have the Take Charge of Your Diabetes workshop. So this is a similar workshop, but it's all about how to better manage your diabetes. So there's education, goal setting, and a lot of great ways for you to improve your health. So this will be on Thursdays from June 3rd until July 15th, from 10 a.m. to 12:30 p.m. Again, this will also take place through Zoom. And if you're interested, you can call 800-757-0202. Interesting, this is just like what Deb mentioned. We have Tai Chi for arthritis and fall prevention. This will be on Wednesdays and Fridays from May 26th until July 15th. Again, Tai Chi for arthritis and fall prevention, Wednesdays and Fridays from May 26th to July 15th. This will be for 1 hour from 11 a.m. to 12 p.m. through Zoom. And again, for this program and all of our programs, you can call the toll-free number at 800-757-0202. We also have the WRAP for Seniors program. So WRAP stands for a Wellness Recovery Action Plan. So that's all about helping to manage our stress and improve our mental health. So this will be on Wednesdays from May 5th until June 9th from 10:30 a.m. till 12 p.m. So this will also be on Zoom. And if you want to register, you can call 800-757-0202. Another program that Deb had also touched on that's very similar is Walk with Ease. So this is a virtual walking program. This will be every Monday from June 7th until July 12th from 10 a.m. to 11:30 a.m. So this is a really great opportunity to connect with others and schedule a time to walk every week. Again, Mondays from June 7th till July 12th, 10 a.m. to 11:30 a.m. This will also be done on Zoom, and you can call our toll-free number for more info or to register. And that number again is 800-757-0202. Next, we have a workshop called Living Well with Chronic Pain. This is a workshop to better cope with your management of chronic pain. Will be on Thursdays from July 8th till August 19th from 1 to 3:30 p.m. The Living Well with Chronic Pain workshop will also be taking place through Zoom. Again, 800-757-0202. We have our Health Legacy program for women. Now, this upcoming group is specifically in Spanish. So the entire session will be done in Spanish. And the Health Legacy program is all about improving our health and how improving our health can improve the health of our families also. So this will be on Tuesdays and Thursdays from May 13th until June 24th from 3 to 5 p.m. We also have a couple fitness classes coming up. So first we have chair strength. So the chair strength class will be on Mondays from May 24th to July 19th from 1:30 to 2:30 p.m. Again, chair strength on Mondays from 1:30 to 2:30 p.m. It is $40 for 8 sessions. So for all 8 sessions, it's $40 total. However, if $40 is too much or something that you can't afford, that's okay. We do have scholarships available. So if you're interested in the chair strength class, you can call 800-757-0202. We also have the gentle chair yoga class coming up. This will be on Thursdays from May 27th till June 15th from 11 a.m. to 12 p.m. This is also $40 for all 8 sessions. And so if you cannot afford this, but you're interested in the class, again, please do give us a call. There are scholarships available. So the gentle chair yoga on Thursdays beginning May 27th will take place through Zoom. And again, you can call 800-757-0202. Next, we have the Coping and Connection in the Time of COVID support group. So this is a support group where you can call in the 3rd Wednesday of every month. And you can speak with one of our social workers. So it's a group, a number of people can call in and join and talk about the stresses and how you're coping with COVID in this time of staying home and all the changes that are taking place. So if you're interested in joining the COVID support group, you can call in the 3rd Wednesday of every month from 3 to 4 p.m. And you can also get that information by calling our main Rush Generations number. Similarly, we have another support group. We have the Diabetes Education and Support Group. This is the 3rd Thursday of every month from 2 to 3 p.m. Again, you can call the Rush Generations number for more details on the number to call in and the date. We also have the Senior Connections Friendly Caller program. So if you're interested in receiving a call once a week from a volunteer, this is a really great program for you. So this is really just to stay connected and to have someone to connect with every week for chatting, and you can pick the time that works best for you. Again, if you're interested in the Friendly Caller program, you can call the Rush Generations number. There's also the Rushed Caregiver Initiative. So if you're a caregiver or if you have a caregiver, this is a really wonderful opportunity. With the Rushed Caregiver Initiative, it starts off with an assessment, so figuring out what the needs are. And then from there, they create a customized approach to best support you. So if you're interested in the Caregiver Initiative and would like that kind of support, you can call the Rushed Caregiver Initiative, and that number is 312-563-0350. And almost there, we have our Shaman Senior Voices program. So Shaman Senior Voices is all about learning from you about what matters most to you. So we recognize that we spend a lot of time talking about child development. We spend a lot of time talking about being an adult, but we don't always talk about the experiences of being an older adult. So our goal is to really learn from you about your experiences and your perspectives, and learning what matters most to you. And so we learned that by recording these 60 to 90-second videos. So you can record a video by visiting bit.ly/recordmystory. So bit.ly/recordmystory. If you go there and you record a video, we'll use those videos to educate our healthcare students and also to have larger conversations around aging, also to have a better understanding of what programs are needed. And just a final reminder that Rush Generations is here with you during this time of social distancing. We have a number of programs, and if you forgot any of them that I said, or if that went a little too fast, that's okay. You can call the Rush Generations toll-free number, which is 800-757-0202, to learn about any of these previous programs and get the information again. If you'd like to become a Rush Generations member, that just means that you'll get updates on our upcoming programs. Then you can also call the 800-757-0202. We also have a Rush Generations Facebook page if you're on Facebook, and on there we also update different articles, and we have updates on our upcoming programs as well. So finally, thank you. Thank you again to all of you who've joined. We really appreciate you, and we look forward to seeing you at our next